A new report from the DEA reveals deaths from fentanyl continue to drop across the country.
Luis Agostini is the spokesman for the DEA here in Chicago. He's joining us now live. Nice to see you, Luis.
Hey, good afternoon, Ben Lourdes. Thanks for having me.
All right, let's talk about this. We've seen Narcan become widely available, and that is the drug that basically reverses an overdose. So what's driving the decline? Do you think it's because of the Narcan, or do you think there are other factors at play here?
I think there are several factors. You hit it right on the head. Narcan definitely one tool that has reversed so many overdoses and has saved countless lives, both here in Chicago and across Cook County and across the country as well. But also you have to count law enforcement, interdiction efforts, and even the community, public health. Everyone, in the past several years, we've been dealing with a fentanyl epidemic, hundreds of thousands of lives lost every single year. But now we're seeing numbers trending in that right direction. Not a cause for celebration, more calibrating our efforts to make sure we keep going in that right direction.
Mm-hmm. So the Trump administration has dramatically reduced illegal border crossings. Does that significantly impact the amount of drugs smuggled into the country, or are most of them smuggled through legal ports of entry?
So we see cartels are trafficking drugs in a variety of ways, especially through ports of entry. Mm-hmm. So definitely, they're finding hidden compartments in cars. Even at the airports, we're seeing a lot of drugs being seized. Mm-hmm. So there's a variety of methods that drug traffickers are working to get fentanyl, heroin, and other drugs here to the country, including here in Chicago.
One of the things that I think about is that there are always new drugs coming up. So it was, fentanyl for a while, then it was xylazine, and so the concern is that there's a new drug coming up, and I'm wondering, is that something that you're concerned about? Are you watching for it? What other tools are you using to address those?
So fentanyl is still the #1 driver of drug overdose deaths. It's about 69–70% of all drug overdose deaths that the CDC recorded. What we're seeing now is other non-opioid substances are being added to fentanyl and heroin. Substances like xylazine, like medetomidine, these are animal tranquilizers. Medetomidine, they call it rhinotrank because it's large enough to put down a large animal, like a rhinoceros. So we're seeing those substances that are not approved for human use being added into fentanyl to create a really stronger effect.
Yeah, one thing I think you mentioned that the DEA's own labs are seeing is that the fentanyl that is being recovered is not as pure as it once was. But you say that's actually cause for more concern, right?
It's right. So the purity, our labs, when they analyze the seized fentanyl, they're noticing a decrease in the purity levels. But what we're seeing now is that's being supplemented by non-opioid sedatives, like xylazine, like medetomidine, which are much cheaper. So think about it from the drug trafficking perspective. They're cutting costs on their end and supplanting fentanyl with medetomidine and xylazine to create that strong effect, to create that continued user, but at a higher profit margin for themselves.
Yeah, and oftentimes they're creating sort of this cocktail where it's fentanyl and a number of other drugs, which makes it so much tougher for law enforcement, right?
Absolutely. Now it's really, we have to send these seized drug exhibits to our labs. You can do a field test for all kinds of drugs. It's only until after our chemists analyze these substances, they can tell you, yes, it's fentanyl, cocaine, and a lot of other drugs that are in the seized substance, even now carfentanil, which is so much more stronger than regular fentanyl. We're now starting to see that in the drug supply.
All right, Luis Agostini from the DEA here in Chicago. Thank you. We appreciate your time.
Thank you so much.